Hi guys, welcome back to Health Talk. My name is Margaret Kireya, and today we are going to talk about vaginal discharges, their color and what they mean. So guys, there are so many people who have asked me about those questions, so relax and let's know the meaning of these vaginal discharges. And guys, if you have not yet subscribed to my channel, kindly hit the subscription button and also remember to turn on the notification bell so that you'll get notified every time I post a new video. So without much further ado, let's go into the video. So, a normal vaginal discharge is supposed to be clear or white. It may increase during ovulation or during hormonal changes, that is during pregnancy. So that's when it is clear or when it is white, that means the vaginal discharge, and that means the body is normal at that time. Vaginal discharge might change. It may change to greenish. When the vaginal changes to greenish, it means there's an infection which is going through, and it can be a sexually transmitted infection. And mostly it could be gonorrhea, that is which presents with greenish vaginal discharge or yellowish vaginal discharge, or it could be an infection of the uterine or cervix. So when you get such a discharge, it's an alarm. So you should just visit a health facility, get checked, and with that, you'll know what could be causing the discharge. Next, a brown vaginal discharge. Normally, you'll see this vaginal discharge at the end of the menstrual cycle. It could also be a sign of implantation during pregnancy. You might see a brown vaginal discharge. It could also be a sign of irregular menstrual period. That is, for example, you are using some of the family planning, and due to hormonal changes, you might get a brown vaginal discharge. So this vaginal discharge, normally it could be due to hormonal. Unless it increases, you can just go and visit a health facility and get checked. Next guys, we have a pink or reddish vaginal discharge. This could be a sign of bleeding. It could also be a sign of infection to the cervix or uterus. So mostly it could be your menstruation which is coming, and in case it persists, you normally know the normal cycle of menstruation. It's between 1 and 7 days. So in case it persists more than 7 days, then that's what we call excessive vaginal bleeding, and with this you need to seek a medical attention. It could be something else that is bleeding other than the menstruation. It could be an infection. So finally, we also have gray vaginal discharge. A gray vaginal discharge indicates a sign of sexually transmitted infections. That is, it could be something we call trichomoniasis. Trichomoniasis. Yeah. Or a sign of pelvic inflammatory disease. So once you see a grayish vaginal discharge that is persistent, just go visit a health facility. And if your vaginal discharge is frothy, smelling, it could be a white discharge, which we talked that it is normal vaginal discharge. But if it is smelling and it has weird smell, it could be a sign of bacterial infections. Some other discharges will accompany themselves with itchiness. You'll have other signs other than the vaginal discharges. So in case you experience those signs, that could be a sign of bacterial infections. In bacterial infections, they are treatable. You just get the antibiotics from the hospital and you get well. So it is important to note the color, the consistency, and the frequency of this vaginal discharge may indicate a health condition that you might be going through without your knowledge. And remember guys, it is always good for ladies, just get checked after every 5 years. We normally do a screening, that is a pap smear, which normally checks the cervical cancer, and once it is detected at an early age, remember, it can be treated. But once we have not done that pap smear, which is done just for screening, maybe you can do it once in a year, once in 3 years. Once it is detected, you'll get the medication as early as possible. But once it delays, once it has progressed maybe to the 3rd stage, that's when it gets hard to get treated. So guys, ladies, always get checked for the cervical screening, that is the pap smear. Always visit a health facility, get the screening, which is free of charge. So guys, thank you so much for watching. I hope I helped somebody who had such questions. So until next time, see you. Remember to like and also to subscribe.